The United States has required drug and alcohol testing for commercial drivers since the 1980s. In Canada, however, drug and alcohol testing is not mandatory for drivers who only drive within Canada. Canadian drivers who drive into the United States are, however, required to take testing according to the U.S. Department of Transportation Regulation 49 CFR. Even though it is not required, carriers in Canada will often have their own drug and alcohol testing policy. Required testing. U.S. DOT Regulation 49 CFR requires drug and/or alcohol tests to be carried out at certain times. Not cooperating with any part of the process is considered a refusal to test and will be treated as a positive test result. Your carrier must remove you from safety-sensitive duties. You must not adulterate or substitute your specimen during a drug test. Doing so is considered a refusal to test. Pre-employment. A new hire must submit a drug test before driving into the United States. An employer may conduct an alcohol test, but it is not required. Reasonable suspicion. If one or more trained supervisors has reason to believe that you are under the influence of drugs or alcohol, they can require a test. This must be based on observations of appearance, behavior, speech, and smell associated with drug or alcohol use. Post-accident. Testing occurs when one or more vehicles is towed from a collision. It is also required if there is an injury requiring medical treatment away from the scene, or if there is a fatality. You are required to remain available for testing. Random. DOT regulations require that your carrier must use a truly random selection process. These tests are unannounced and spread throughout the year. Return to duty. If a prohibited drug or alcohol rule has been broken, you must submit a drug and alcohol test before you may return to safety-sensitive functions. Follow up. In the event of a return to duty situation, you are subject to unannounced testing for 12 to 60 months. A substance abuse professional will determine the length of testing. This testing will be in addition to other normally required testing. Carriers. Under Regulation 49 CFR Part 40, carriers are responsible for developing policies and procedures for drug and alcohol testing. Your carrier's workplace policy must identify which categories of drivers are subject to testing, describe prohibited behavior, describe testing procedures, describe consequences for violating the controlled substance and alcohol regulations, educating drivers and supervisors about drug and alcohol testing. A carrier must provide drivers with educational materials that explain the policies and procedures for drug and alcohol testing. A carrier must also provide information on the effects and consequences of substance abuse. Supervisors must receive additional training. Collection and testing. A carrier must establish a program that follows DOT regulations. Keeping records and reports of test results. A carrier must maintain and submit testing records to the DOT if they are requested. The following documents must be kept: test results, test process and administration, return to duty process administration, employee training, and supervisor training. Your carrier must immediately remove you from driving a commercial motor vehicle in the event you test positive. They must then refer you to a substance abuse professional for evaluation. Supervisors. A supervisor must make sure that all required drug and alcohol testing is completed according to company policy and DOT regulations. They must be able to explain the policy and regulations to fellow employees and follow up with the carrier on any issues they cannot explain. They must also be able to recognize signs of drug or alcohol abuse and take the appropriate actions. Drug and alcohol effects. One drink can reduce your ability to concentrate and react to things that happen suddenly while you are driving. The more alcohol in your blood, the more difficulty you have judging distances and reacting to sudden hazards on the road. To make matters even worse, your vision may become blurred. Any drug that changes your mood or the way you see and feel will affect the way you drive. This is not only true for illegal drugs. There are prescription drugs and some over-the-counter drugs that can also impair your driving ability. Before taking prescription drugs, provide your physicians with a detailed description of your job tasks. Never take more than the dosage prescribed. Medical marijuana is not permitted for anyone who performs safety-sensitive tasks. Blood alcohol concentration. The amount of alcohol in the bloodstream is known as blood alcohol concentration. The higher the BAC, the higher the level of intoxication. When you consume more alcohol than your body can metabolize, your BAC rises. Even low BAC levels can result in impaired senses and loss of coordination. Driving skills. The specific driving skills affected by even low BAC levels are voluntary eye movement. This ability is needed to track moving objects and judge distances. It becomes impaired at 0.03 to 0.05% BAC. Hand-eye coordination and reaction time. This affects your ability to steer. It is impaired at levels as low as 0.035% BAC. Attention! Drivers must handle multiple tasks at the same time. As BAC levels rise, your ability to focus on multiple tasks decreases. This ability is impaired as low as 0.02% BAC. Controlled substances. The United States Controlled Substance Act regulates several aspects of certain substances. When you are tested, you are screened for the following substances found in Schedules 1 and 2 of the Act: amphetamines, methamphetamines, and MDMA. Driving ability can be impaired by dizziness, panic, and inability to concentrate. Use can cause malnutrition and prolonged sleeplessness, leading to general deterioration, exhaustion, extreme nervousness, and sometimes serious psychological problems. Cocaine. Driving ability can be impaired because of hallucinations, restlessness, and aggressive behavior. Long-term use can cause weight loss and malnourishment. Marijuana impairs judgment and motor coordination and doubles a driver's risk of collision. In high doses, it can cause temporary hallucinations and paranoia. Though it is legal for medical and recreational use in some states, you may not use it while operating a commercial vehicle. Opiates. These include heroin, morphine, and codeine. Driving is affected by impaired alertness, vision, and coordination. It can also cause sleeplessness, constipation, nausea, and vomiting. Long-term effects include collapsed veins, infection of heart lining and valves, liver and kidney disease. Phencyclidine. It causes hallucinations and rapid mood swings, memory loss, loss of concentration, and impaired coordination, affecting your driving. Symptoms can persist up to 1 year after stopping PCP abuse. Alcohol and controlled substance restrictions. You must not report for service or remain on duty if you are under the influence or impaired by alcohol, or you have a blood alcohol concentration of 0.04 or greater. You must not consume alcohol within 4 hours of reporting for service or after receiving notice to report. If test results show that you have a BAC of between 0.02 and 0.04, you may not perform safety-sensitive functions for 24 hours. You must not report for duty or remain on duty when using any controlled substance unless used according to the instructions of an authorized medical practitioner. Drug and alcohol possession. CFR subsections 392.3 and 392.4 outline restrictions on the possession of drugs and alcohol. Under these rules, you may not possess any of the following for personal use in your cab or sleeper berth: any Schedule I substance, such as marijuana or cocaine; amphetamines; opiates or narcotics, such as heroin, morphine, or codeine; alcohol, or any other substance that will prevent a driver from safely operating a motor vehicle. These rules do not apply to prescriptions that have been prescribed by a professional doctor and substances which are transported as part of a shipment.